Hello, I'm Dr. Padidar. I'm an interventional radiologist at Regional Medical Center, San Jose. I wanted to talk to you today about abdominal aortic aneurysms. Basically, that is an enlargement of the abdominal aorta that becomes balloon-like and can potentially rupture. Each year, many patients across this country die of abdominal aortic aneurysms. And in fact, so many that there's now screenings that are paid for by Medicare. The conventional symptoms that we see for abdominal aortic aneurysms are abdominal pain, back pain, and nausea and vomiting. If you have any of these symptoms, you would like to go to your physician and request an abdominal ultrasound to screen for it. Patients who have a history of smoking or hypertension or obesity are at highest risk. The conventional treatment for this is an open abdominal surgical repair where the abdominal aorta is repaired and a tube graft, a plastic tube, is inserted inside it. The newer techniques that we do at Regional Medical Center are non-surgical and done through a little needle through the groin. And here we have pictures of before and after of the abdominal aortic procedure. So on your left you can see a picture of an abdominal aorta ballooning, and then the flow of the blood goes to the legs. On the right is the repaired picture after we have placed a stent graft within this abdominal aortic aneurysm. Here's a picture of the stent graft that we have inserted into this patient. Basically, stent graft procedures have made a significant revolution in this disease. We can do these patients as an outpatient with a one-night stay and to discharge them the next day. And patients can be very mobile very soon after the procedure. I recommend that all of you get screened for this and consider Regional Medical Center for your care. Hello, my name is Dr. Padidar. I'm an interventional radiologist here at Regional Medical Center, San Jose. I would like to speak to you today about carotid stenting. Carotid stenting is a procedure we do for patients who have carotid stenosis. The carotid artery is the blood vessel right here that supplies your brain. In patients who have atherosclerosis or patients who have diabetes, high blood pressure, obesity, high cholesterol, smokers are at higher risk of having carotid stenosis. Usually the symptoms of carotid stenosis are stroke symptoms, such as weakness in one arm or one leg, numbness, not being able to see out of that eye, speech difficulties, or walking difficulty. The conventional treatment for this is open surgery, where the neck is dissected under general anesthesia and the blockage is removed. However, many of our patients are either too sick or do not wish to have open surgery. Here at Regional Medical Center, we can do carotid stenting. On your left is a picture of a patient who has a carotid stenosis. And this is the blood vessel again that supplies the brain. It is critical that we open this blood vessel. On your right is a picture after the stent has been deployed and the narrowing has been repaired. Here is a device that we use to do carotid stenting. Basically, it's a stent similar to a chicken wire tubing. After the repair is done, the patient is kept in the ICU for one night and discharged the subsequent day. There's minimum recovery and minimum pain with only a Band-Aid at the groin. Here at Regional Medical Center, we have been involved in many clinical trials, including carotid stenting, and this is an option for patients who are either too sick or don't wish to have open surgery. Thank you. Hello, my name is Dr. Padidar. I'm an interventional radiologist here at Regional Medical Center of San Jose. I'd like to speak to you today about blood clots, or we call it deep venous thrombosis, or DVT. Blood clots usually happen in the lower extremities in the legs, in the calves or thighs, and they can travel to your lung and cause an embolism. The common symptoms of blood clots are swelling and pain and redness. If it carries and travels to your lungs and causes an embolism, then the symptoms will be chest pain and shortness of breath. Obviously, from the sound of it, this is a deadly disease and it happens commonly. It can happen in young patients and older patients. The common causes are being sedentary, having a trauma to the legs, such as a leg fracture, or having too thick of a blood, or what we call hypercoagulable problems. Some of the conventional treatments for blood clots, or DVT, are thinning the blood with anticoagulation, such as heparin or Coumadin. These are very good medicines, however, they have their own problems, and we will try not to use them long term, especially in younger patients. There are some other treatments for deep venous thrombosis that we do perform at Regional Medical Center. Those are catheter-directed procedures. Basically, we advance through a little IV in the back of the leg and basically try to clean out the blood clot that is lodged in the blood vessel. My analogy to this is the plumbers that use liquid Drano to dissolve this, and we use clot-busting medicines such as TPA. Or we have Roto-Rooter devices which can clean out the blood vessel mechanically. On your left is a catheter which, similar to a garden hose, can spray these blood clot-busting devices and can dissolve this blood clot. On your right is a mechanical device used to treat these patients. Again, this is another slide to show what a blood clot looks like on a venogram on our angiography table. A venogram is basically x-rays of the leg that we inject iodine to see these blood clots. Finally, this is a picture demonstrating after we have used our mechanical devices and restored blood flow in that vessel. So I recommend that if you are having any of these symptoms, such as leg pain, shortness of breath, chest pain, that you see your physician. At Regional Medical Center, we don't only treat you with heparin and Coumadin, we also remove the blood clots, which can be a problem for you in the future. Thank you.